This is the Arm Doctor. The Arm Doctor is a therapeutic device which is designed to treat repetitive stress disorders in the forearm that can affect the median nerve, causing carpal tunnel, ulnar nerve, causing numbness, tingling, and weakness in the ring and little finger, and also the radial nerve, which causes problems in the fingertips and in the back side of the thumb and first finger. When you're first using the Arm Doctor, there's four comfortable rollers. You would use a band. You have the resistance bands, and you'd have one on each set of rollers. So you'd have 1, 2, 3, 4 bands. So you take the band, stretch it out, and put it on the roller. We already have one band on there. That is how you start. That is the softest and least resistive. Then you take your hand, remove your jewelry, anything like that, and then you would slowly insert your hand in between the rollers, down through the wrist and into the forearm. And you can kind of see how the rollers will absorb around or wrap around the tissues in the forearm and the wrist as it comes in and out. You can work it a little bit up and down, take it in and take it out, up to the elbow, and then pull it back out. Also, as you're doing this, you can rotate your arm just a little bit to change the muscles that you are on or the nerve that you're trying to release. With the first set of straps, it is a light resistance, so it's more getting the tissues used to being worked on, flushing the arm out a little bit. Next, you would take and add a second set. After doing that for a couple minutes, you'd add a second set of straps. And each time you add a set of straps to the rollers, you get increased resistance. Again, you repeat for about a couple of minutes, 1 to 2 minutes, and slowly insert, and you'll feel that you have an increase in tension. And this acts more like a massage release into the forearms and into the tissues around it. And you can just repeat this. And what's nice about having the Arm Doctor around is you can do it 2 or 3 times throughout the day if you do a lot of repetitive work, like such as computers, gripping work tools, hairstylists, gripping scissors, things like that. And again, the soft rollers make it comfortable, and then the firmness underneath the rollers gives you the pressure and the tension you need to get results of a neuromuscular release. And then you pull it back out. And you'll feel that, and sometimes you'll feel the tingling in the arm, you'll feel the blood flow. And you'll add the third set. This is designed to hold up to 4 bands. Again, you just repeat the system. And now you'll start to feel quite a bit of resistance in the bands. So you slow the process down, and now you can start to get the neuromuscular release that you're looking for. You can roll it in and out, opening and closing the fist while you use it, or waving your hand back and forth. Back and forth. Just slower. So when the resistance increases, you'll do it slower. You do not get more relief just by going fast. Fast is not necessarily the way to go with this. And you'll feel it when you get on those nerves that are trapped under the pronator. Maybe you want to use that right there a little bit, roll it back and forth. Like so. I don't recommend going more than 3. Athletes will sometimes want to use 4, or we have firm rollers that also go with this for athletes.